Gary, you just heard all of that from the doctors, the healthcare workers there. What are your thoughts when you hear this sort of, testimony that they just don't have what they need?
Well, it is a shame and too bad that we haven't been better prepared. Many countries around the world have terrific public health systems that are ready for this, and this is just we have a great medical system in many cases with great technology, but in other cases we're lacking, and we were not prepared for this, and we're paying the price.
Gary, you run an international relief organization called Heart to Heart International. You've responded to crises all over the world, tsunamis, hurricanes, earthquakes. This is really unique in how, and overwhelming in scope. How do you respond to this one?
Well, it's all hands on deck, and you've been in those situations where you just do everything you can. You pull together all the resources, all the volunteers. We're announcing in another day or two here in Kansas City what we're calling the COVID Care Force, and this is an effort to mobilize many hundreds and thousands of healthcare professionals. Be ready when it hits Kansas and Missouri. New York has been calling for volunteers, and it's almost too late. It's not. We should all do what we can. I may be coming to New York this weekend to volunteer, but we know it's coming here to the Midwest, and we want to be ready. So we're standing up a great force of volunteer healthcare professionals to serve in the hospitals wherever there's a need.
And Gary, in terms of mobilizing, it's just growing dramatically. You mentioned New York, a Boston television news team, WFXT, compiling the numbers there in Massachusetts. 600 Massachusetts hospital workers testing positive for COVID-19. This is really going to take a toll as we move on with this pandemic, isn't it?
Absolutely, and healthcare workers are on the front lines. I joined the Army Reserves many years ago, and I did it because I wanted to serve people in need, soldiers and civilians, and healthcare workers. It's a war, and they are voluntarily going into combat, into these EDs, ERs, and serving. And so my hat's off to them, and that's why I want to do what I can and rally as many people around me to do the same thing. And if I put my life at risk, that's why I went into medicine in the first place. That's why most people serve in medicine and healthcare. They want to help people, and there is a price we have to pay. Unfortunately.
And there's this headline from a UK publication just a few days ago, coronavirus dentists to help staff the new hospitals going up. I mean, that shows just how limited the resources are, in a sense that they're calling on dentists to help. I mean, how do you mobilize, and who are you looking for to help in this regard?
Well, first of all, you're looking for the most qualified people you can. I have a network. I have another company that staffs emergency departments around the Midwest. We have 350 doctors. We serve in 100 hospitals. So we're asking all of them, can you take some extra time, some extra shifts? Can you take some days? We'll figure this out. We'll get the schedule. But we do need to be ready. We're also asking for retired healthcare workers. One of the things that our country has done, the U.S., is waived all the licensure requirements that go state to state. So now a doctor in Kansas can go to Washington State or New York State and work and serve without having to go through months of waiting on a state licensure. So we're asking for all kinds of healthcare workers, nursing assistants, medical assistants. It's going to take everyone. Perhaps we'll even get to the place where we'll ask for non-healthcare volunteers. We just need you to help us move patients around the hospital or provide security in the waiting rooms. I don't know. But we have to all just jump in here and do what we can, because otherwise millions of people are going to die in the United States.
And Gary, you've worked in a lot of rural hospitals in the Midwest. We're hearing about these large cities like New York, Los Angeles, up in Seattle, and now New Orleans, but people really aren't talking about some of these rural areas. This can spread like wildfire, as you know. Are these smaller communities ready?
No, they're not. And my original thought was to get a group of volunteers, primarily providers, doctors, nurse practitioners, and PAs, and to be ready to help these small rural hospitals. In the United States, these small hospitals, every county has one, just about, in most parts of the country. They only have 1 or 2 doctors on their staff. They might have 10 or 12 nurses. What happens when one doctor gets sick or has having to quarantine? What happens if a couple of nurses? they have no bench. They're going to have to close. And really, this pandemic is going to hit every city, every rural town, every hamlet, every village. It's going to be everywhere. And so one of the things I am especially worried about are the rural hospitals in the United States.
Dr. Gary Morse, thanks so much for your time. Appreciate it.
Thank you.